Hi everyone, my name is Maureen Osaka. Today I'll be presenting on forces that affect healthcare organization under the course of legal and ethical issue in healthcare administration. My focus today will be on three parts. Number one part will be regulatory accreditation and organizational compliance policy. Under this part, I have foundation of healthcare management, key regulatory requirements, accreditation standard, organizational compliance strategy, impact on daily operation, and implementation consideration. Then on my second part, remember I said it will be three parts. On the second part, I'll be looking into critical area for ensuring patient safety. Critical area for ensuring patient safety. And under this, we'll be talking about infection control, medication safety, patient identification, fall prevention, effective communication, organizational culture and safety, and implementation challenges. And the third, but not the least, will be quality as a guiding principle in cost control. Under it, I'll be discussing about role of quality in cost management, quality improvement initiative, cost reduction through quality, which reduces length of stay, and the rest of it, standardization and efficiency, organizational impact, long-term care outcome. So let's go to the first one, which I'm going to start treating right now. On the first one, we have regulatory accreditation and organizational compliance policy. Under this, we have foundation of healthcare management, which provide a structural framework for safe, legal, and ethical healthcare delivery, ensuring accountability, risk management, and operational consistency. Number two is key regulatory requirements, which has to do with Health Insurance Portability and Accountability Act, protect patient privacy and health information, Center for Medicare and Medicaid Services, set standards for reimbursement, quality, and clinical care. And the next one will be accreditation standard, which cover the Joint Commission establishes patient safety goal, quality benchmark, and continuous improvement requirement, drive development of standardized safety protocol and performance monitoring. Next is organizational compliance strategy. Internal policy aligned with federal regulation and accreditation requirements, include auditing, staff education, and compliance monitoring system, promote accountability, transparency, and organizational resilience. Impact on daily operation. This guide clinical documentation, billing practices, and patient care delivery. Required adherence to legal and ethical standards in routine workflow. Support collaboration between leadership and frontline staff. Implementation consideration. Required adequate resource, trained personnel, and effective oversight. Success depends on integrating policy into everyday clinical practice. Reinforces a culture of compliance, safety, and ethical conduct. So all this talk about the first step in the establishment of establishment policy. So the next one we're looking into is critical area for ensuring patient safety. This critical area starts with infection control, encourage hand washing, and then medication safety. This depends on safe prescribing, dispensing, and administration process. Reduces adverse effects event leak to system failure and human error. Another is patient identification. Use of multiple identifiers to prevent wrong patient error. Ensure correct treatment and procedure, which means identification of patients is very, very important to avoid error. Right part of procedure, right medication, right dose, right route. The 6 rights of patient medication administration. So another one is effective communication. Clear information exchange among healthcare team reduces error-related and miscommunication and care transition. Communicate effectively. Collaborate effectively. All this will help in the safety of the patient. So another one we want to talk about, which is the third one, is quality as a guiding principle in cost control. Under this, we have the role of quality in health in cost management, which improve patient outcome while reducing unnecessary expenses. Align patient safety with financial sustainability. Quality improvement initiative, evidence-based care pathway, error reduction, prevent care intervention, cost reduction through quality, decrease hospital-acquired infection, because once there is hospital-acquired infection, the hospital is bound to lose. They will lose because Medicare and Medicaid, they are looking into that. Because once there is a acquired infection in the hospital, it's a mismanagement, and the hospital will never be reimbursed for that. Another one is reducing length of stay in the hospital, readmission, legal and liability costs, and resources overutilization. All this, they are looking into it to make sure that every patient deals with necessity. All they are managing patient is what it is necessary, and not overutilization of resources just for payment and the rest of it. Manage patient effectively so that patient will not be readmitted within 2 days, even within 30 days of discharge. That is the demand of Medicare. Standardize and efficiency. Promote consistency, adherence to clinical protocol. Minimize duplication of service and real work. Enhance workflow efficiency, operational impact, strengthen governance and compliance structure, encourage a culture of continuous improvement, long-term outcome. Create a sustainable healthcare delivery model, and then finally, enhance cost control with high-quality, patient-centered care. Thank you so much. And if you have any question, drop it in my comment section. Thank you.